Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining us again this week. We have another important topic to discuss today. With me is Esther Woghiren. Did I get that right, Esther?
Yes.
And today we're going to talk about personal care homes as a choice for living if you have a senior who just isn't safe at home anymore. We're going to talk about different ways in order to choose the right personal care home for you, how it could be a great alternative to an assisted living facility, and why you might want to check into it before you think it's time. So Esther, welcome today to Better Living. I'm excited to have you on and excited to educate and inform seniors and our families about this important topic.
It's a pleasure being here.
So do you find that people wait too long to come and see you and try to get educated about what personal care, or do they even know what a personal care home is?
Not too many people know about personal care home. They do know about the traditional assisted living home, but not personal care homes.
Yeah, and I want to get into the differences between personal care home and assisted living, but being from Boston, I do tend to jump head first into subjects, and I'm so excited. I'm going to take a step back now for a minute.
Okay.
First, let's introduce yourself.
Sure.
Tell the listeners a little bit about you and how you got into the personal care home business and where your personal care homes are located.
Sure. My name is Esther Woghiren, and I actually moved from Boston.
You did?
Yes, from
Oh,
2004.
fellow Bostonian. I didn't even know it.
Yeah, I moved from Boston 2004 after I had actually received my LPN. But before then, I was a CNA for a long time, about 9 years of my life when I came here. But I started getting interested in the geriatric care for the seniors because it was very close to my heart. I work with them very closely. And when we got to here in Atlanta, my husband and I decided that this is a business that we could actually do. Because while I was in school, I actually decided that I would love to take care of a group of seniors and be in control, so that I'm quite sure that they'll get the best care if I do it that way, instead of working as a nurse in a big corporate place, just to make sure people see my work.
I love that you were a CNA.
Mm-hmm.
And went on to
become
get
a nurse.
More education and become a nurse. And the sky was the limit. You just didn't limit yourself. And you said there's a need for these people to feel like they're at home and have somebody at their home taking care of them the way they should be taken care of.
That's correct.
That's a wonderful story. I didn't know that.
Yes.
Where are you from in Boston?
Lynn, Massachusetts.
Lynn,
yes.
I know that song,
Really?
Okay, I'm sorry, listeners. That was for my own selfish desires. Okay, so let's talk about what personal care homes that you own here, because I know you have 6 in the Marietta, Georgia area.
That's correct. The name of our personal care home is the Brittany House. Brittany House, we actually bought it over from the previous owner in 2004. It was a group of 3 personal care homes that take care of seniors. But since then, I've increased it to 6 because of the needs.
There is a big need.
Big need for it. And, it's just unbelievable. Every day I feel like opening a new one because, people keep asking, are you going to come to my area? Are you going to come here? But there's overwhelming need for this because every day somebody is being diagnosed with any senior-related disease.
It's just, when does it become a point where you're just no longer safe? When safety is the issue, and it's such a tough choice because I want my mom or my dad or my grandmother or my grandfather, or aunt and uncle, whoever, to be as independent as possible, and I don't want to be the bearer of bad news and take that independence away. Mm-hmm. But we were faced with this when I was younger, and I was pregnant with one of my children, so it had to have been over 12 years ago. And, when they start to forget to turn the oven off.
That's right.
Then you say, is it better to be the bad guy or lose my loved one to an unnecessary fire because they're not safe anymore?
Right.
And so if we have influenced you to just kind of think about it, stay tuned, continue to listen to us. We have lots of very good information for you. If you find yourself in the situation where a loved one, a neighbor, a friend is in a possible unsafe environment for themselves. So, Esther, let's first educate the communities, because I know we're talking about Georgia,
Yes.
but in Arizona, in New Orleans, in the Gulf Coast, everywhere else that we air, there are personal care homes, or they might be called residential care homes, or in Arizona, they might be called group homes. But it's the same thing. How does it differ from an assisted living facility, the more well-known, large, hotel-looking assisted living facilities?
Well, it's very different. We're similar in some ways, but we're very different in other ways. The traditional assisted living have, like 40 at the least of residents. When your loved one have dementia or a memory loss issue, I just advise that if she can still take advantage of the social activities in the big traditional assisted living, where you can still leave the loved one there. But when it becomes that they need more attention, more care, they're wandering, they can feed themselves but still have very short attention span, you start looking into the small homes. Because why? We have it's licensed for 6 or less in the small personal care home. So we have the staff there to actually attend to their needs. And this staff study the residents, they know their personality. It becomes like home to them.
Let's talk about staffing, because I
Yes.
think this is so important when people are looking at whether it be an assisted living facility or a personal care home. If you're not asking questions about who's the staff on during the day shift, who's the staff on during the night shift, who do you have overnight, then you're not doing your due diligence. And the day shift is very different from the evening and the night shift.
That's right.
So let's talk about your home. You have 6 residents or less in each house. So you can give individualized care.
Yes.
How many people do you have on all the different shifts?
Well, what we've tried to do is we've found out with memory care is actually better to have like a live-in. We call them like
live-in.
house mom, a live-in caregiver, because it becomes like I said, it's just like home. So it's like they're living with their daughter, because this person is who they see every day. Instead of bringing in new people every other, like every 8 hours or every 12 hours, is so confusing because
It's
everybody.
not shift work. It's a family
It's not
member
shift. It's a
now
family member
to
now.
them.
So we all live together and eat together and do everything together. So that worked out real perfect for the personal care home, real good. So like I said, this staff knows everything about this resident now. So it's like more of like a daughter-mother relationship between the staff and the resident. So it has really worked out fine with this type of arrangement, that we find it very, very safe. The caregiver is there at night in case of emergency, so she can wake up at night and check on the residents. So that, I think that's different between us and the assisted living, because in the assisted living they have the shift work and people are coming, there's turnover all the time. Whereas we don't do that.
And is that caregiver a CNA?
Yes, they are certified CNA. We
Certified?
have two
Okay.
very certified CNAs. They all have background checks, physical and TB tests to be qualified to take care of individuals in our homes.
And I like the 6-to-1 ratio.
Yes.
It's nice to have. It really truly looks like a home.
Yes, it is a home.
It's not a facility.
No, we
You-
call it
you're
home
walking
away
into
from
a
home.
house.
Yes.
To each their own. But, I didn't grow up in a hotel-like setting. And so for me, personally, it would be nice to have that closer to that one-on-one care. 1 to 6 is nice care. It all depends on what, is best suitable, how
For each
you're going to meet
residence.
your own needs and your own choices. But I love the idea of the personal care home. And, there's been some news in Georgia about personal care homes that hasn't been positive. And I wanted you on this show because I wanted people to know it's owner by owner. And you just have to do your due diligence and ask the right questions.
That's right.
And get to know the people that are going to be caring for your loved one. As in everything. My sons are in school. I like one teacher better than the other.
That's right.
So I feared that with this negative publicity here in Atlanta, it would hurt all personal care homeowners. And so I'm so pleased to have you on the show today
Thank
so
you for
that people
having
can
me.
meet you, because I know the good work you do in your facilities.
Thank you.
So that being said, let's talk about your personal care homes and what might make you different in addition to the caregiver living in the building and you doing all of the activities and eating like a family with your folks.
Well, thank you for that. I'm a licensed nurse by profession, And what makes me different is because I'm hands-on person. These homes I go to, I take care of my residents. The staff see me doing the work, and they know how important and close to my heart these residents are. So I think it's very different because you never find owner on the premises of some of the personal care homes or assisted living homes. So that really, really separates me from every other person out there, because I wake up every morning looking forward to go to work, because every one of them is precious to me. So
yeah, and I've seen that.
Yes.
You know, I walked in and you were right there. Actually, I think you were getting pillows out of your car or something,
Yes.
Linens or something.
Oh, I have
right
gloves.
down to the dog that's at your at your heels going in. You even have a dog on the in the building. What was the dog's name again?
Pudding.
Pudding. Yes, Pudding. Looks like my Stella at home. Okay, so let's talk about personal care homes versus assisted livings as well in terms of regulation, because I want to educate the public on the differences there too. That may make a difference in how they choose where their loved one is to go. Can you talk a little bit about that?
Okay, we are regulated by the state. If you want to really find out the personal care home, if it's licensed or not, because there are many unlicensed personal care homes out there.
Are there still?
Yes, just to advise, there are many. They're cracking down on them, but there's still many out there. You want to go to the DCH website, dch.gov.
Department of Community Health.
That's right, Department of Community Health. You pull out all the personal care home in your area. You can actually check the reports from them.
And make sure that you're choosing one that's licensed.
Exactly.
Because now you're regulated and checked.
We are
and
regulated.
audited.
Mm-hmm. So the Brittany House is there. You'll see all the Brittany houses. They are there. You can click on the reports, and it show you all the reports every year. And you have to ask questions. You have to ask, time for meal, what you do, why do you think my parents will be happy in your home? And for my home, I try to tell the truth. I tell the families what they're facing, I just don't try to just lead people along. I tell you, if your mom has this condition, it's gonna get worse. It doesn't get better. We're going down, but we're gonna make the most of it. Every day, our job is to make sure your mom is happy, is cared for. She's dry.
Is not left alone.
It's not left alone. Mm-hmm. So that's the biggest thing, that she's not being neglected just because she's not like everybody else. Mm-hmm.
And I know that you hold your vendors to very high expectations,
yes,
as well as yourself. And yes, so I want to talk about that, because more questions for you to ask when you're looking at a personal care home or an assisted living facility is, how do you work with other resources in the community, and how do we know that you're picking the best ones to bring into this building, and how do you manage them? Now, Esther, I know that you manage them and you hold them to high expectations. So yes, let's talk about that, because I really do think it's important. Because when you go to an assisted living facility or a personal care home, you're really not just going to have that staff, because there are additional resources like home health or hospice or in Georgia, the SOURCE program maybe, or CCSP. I don't know how that works in a personal care home.
Yes.
And so you are really the general contractor of the building.
That's right.
Managing all of the subcontractors. And so, like everything else in life, you have to make sure you're hiring the general contractor that has the leadership abilities to manage those subcontractors the right way.
Yes.
So, Esther, let's talk about that, because I do think, from what I've seen, that's a strength in
right.
you.
Well, how I hire people, like you mentioned, I work with home health communities, hospices, the Medicaid program, the VA program. That I would love to really specify on that, because some families don't know that they can get benefits for their loved one through VA. But the way I hire people...
And stay tuned, because we're going to talk about cost and how the VA benefits can help you later in the show.
That's right. So the way I hire people, I tell, like I have many people walk into my office every day, hospice company, home health company, and they ask me, who do you use? I said, I don't use anybody. I just use the person that will give my resident the best care, because that's my priority. So when you come into my home, the question I ask is if you're going to put my resident first. I don't want to hear, I have another patient in another home, that person I have to go do first before I come and take care of your patient. Okay. Yeah, I get so emotional when it comes
She's
to my
passionate.
residents.
She started talking very quickly. I said, we have to slow down so
Yes.
people can hear you. So there's
Okay.
that passion and there's that leadership. And
Yes.
that's what I'm trying to get at for these consumers. You want to hear that
Yes.
in the heart of the folks that you're interviewing when you have to make this decision, because truly, whenever anybody is set apart from competition, it truly has to do with the leader of that company. And so what you're saying, Esther, is I'm not just looking for a company. I'm looking for a heart.
That's right. That's right. That's what I'm looking for. I'm looking for somebody that will put my resident first. I don't want them to be last because they are priority.
And that means that you're not going to put up with, oh, I can't get there.
Exactly.
Well, it's not I can't. It's how are you going to make it happen?
How are you going to make it happen? You know, I can't get there, but call me ahead of time and tell me, okay, I'm running late. You know, if I call you on a residence, just tell me, Esther, I'm going to be 15 minutes late. I'll stay there until you get there. But when you don't call and you leave my resident unattended, then I get offended for that.
And so as a family member looking into a choice of where to place a loved one, you know, we have to give choice. It's healthcare. It's
That's
a
right.
rule. You absolutely have to give family members choice so that we can empower you to make the best decision for you. But to get you there, you have to be certain that the choices you're given are the best choices.
Yes.
And so it's still very important for the person that you're placing your loved one with to have chosen the top 3
That's
best
right.
choices for which you can choose from. And so asking them about ancillary services and additional resources and how they manage and choose them and what they've seen from them is perfectly appropriate as long as we are giving you the choice to choose between a few companies.
That's right. That's right.
What about activities? How active are your facilities?
My different facility depends on how active the residents are. I have a central location where we have activities there. I have more active residents there. Like you understand about these residents, you have to follow their pace. You know, if you know a resident cannot stand like 10 minutes of activity, you don't need to put her in that activities. So we have a central location where all the residents that are active go for activities. We have like bingo, trivias, and different companies come in there and perform, dance, you know, sing for the residents. So we have a lot of activities for the residents.
How do you help families prepare when they come to see you? Because it's a difficult choice.
Very difficult. I'll never forget one of my residents' daughter. She was moving her mom from a larger assisted living and she came to see me. Somebody had given her my number and she sat down with me and I spoke to her about what we need to do because her mom was not eating. She was just taking the Ensure. And said because nobody will feed her, you know, especially when you're coming from a large place. Nobody have time to spend with you. So after I told her, I said, listen, I can do this. And your mom will eat again.
And not to interrupt you, but sometimes larger doesn't mean more staff.
No, larger doesn't mean more
Larger
staff.
can mean more patients or more residents per staff member.
That's
and
right.
those are questions you want to ask too. Remember, Better Living is brought to you by the Homestead Hope Foundation, and we are here to educate and inform you about all aspects of senior living. And if I'm doing my job correctly, I'm helping you figure out what questions to ask so that you do your due diligence.
That's right.
And so it's very important to ask those ratios, again, shift by shift by shift, because just because it's large and pretty doesn't necessarily mean that your loved one is going to get better care.
That's correct.
Okay, I'm sorry. So go ahead.
That's correct. And let me stress that, you know, with the state regulation, it's actually 1 staff to 15. During the day and at night, 1 staff to 25. So don't be surprised in that large facility with 25 residents, you have 1 person. And, you know, compared to our home, it's like 6 or 5 to 1. Actually, we have 3 to 1, mainly because when this house is full, like 6 patients, we have 1 and we have another person half a day, so like almost 2 to 6.
Wow.
Yeah, so when I spoke to Karen, let me finish the
Please,
story.
I'm sorry.
After we finished, she just got up. She said, Esther, can you please give me a hug? I said, sure. I said, why? She said, because you make something that looks so big, so simple. because I didn't have any hope coming here, and you just gave me a peace of mind. I mean, that's why I do this every day, because, you find people like this that are pushed to the corner. They don't even know where to go.
And they just don't know what to do.
They don't know what to do. But it's your job now. Like, I call myself a counselor, financial advisor, an attorney sometimes for power of attorneys. I do all that because I want to prepare the families on what they're facing with their loved one.
Wonderful, Esther.
Yes.
Can you give out your contact information if someone in Georgia is going through this right now and they can contact you perhaps?
Sure. The number to reach me is 678-313-4673.
And again, Esther has 6 different personal care homes
That's
throughout
right.
Marietta. But even if you're not in the Marietta area, she may be able to connect you because she's a resource. So,
That's right.
Or she can help you with more questions that you might want to ask in your areas as well.
That's right.
Not to throw that out there and make you busy on the phone, but I know you'll give them good
I
information.
get that all the
Esther.
time anyway.
Let's quickly talk about cost. We have a couple minutes now before we have to go to break.
Okay.
What is the typical cost of a personal care home?
Okay. In our personal care home, our private rate is $2,500. The shared room ranges from $18 to $22.50. So we do that because if someone is wheelchair bound, it's like additional $250 because extra work to do that. But
That's why there's a range.
That's
'cause
why
it
there's
also
a
depends
range.
on
It
your
depends.
need.
Yeah. If your loved one is like ambulatory, you may be paying like $1,800. Which is like
Not bad.
1/3 of what you'll pay with traditional assisted living.
Right, because it could be $4,500, $5,000.
I mean, I've had people that were paying $9,000. I'm
9,000.
telling you. So we're just a fraction of that, and we give more care. That's the benefit. We give more care.
And then quickly, even that can seem daunting to some folks.
That's right.
And so what you need to know is there's also help out there for you. So let's talk quickly about VA benefits.
Okay, with VA benefit, if a loved one has served in any war or has been in the service for at least 90 days and was discharged honorably, they are qualified for assistance. For the person, is up to $1,600, and for a spouse, is $1,056.
So that's a huge
A
benefit.
huge benefit, and some of the families don't even know anything about this.
Now, if you were to have spouses in a room, that would be $1,800 to $2,200 as well?
Now, if I have a couple, I actually do the first spouse is $25, and the second, we do $3,800 for a couple.
Okay,
So we give a
$3,800.
discount for them being a couple because
Of
it's staying
which
in
you
the same
could
room.
be getting up to $2,500 on the VA benefit, or $2,200. I don't know if I got the math
That's
right.
right. Yeah, if you're getting VA benefit, like for a couple, it will be about $2,700 from VA.
So the two of you in a personal care home could pay $1,100 a month.
That's right.
That's fantastic.
That's right.
Well, we do have to go to break, but I appreciate you being on the show. I think we hit a lot of different areas about personal care homes and did give folks some things to think about and some good questions to ask. Now, stay tuned with us because when we come back, we've got even more information for you. We'll delve a little bit more into that VA benefit, and we're going to talk about more questions that you should be aware of when having to choose a personal care home for a loved one. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Welcome back to Better Living. I'm Jean Pete. Thanks for staying with us because we do have an important topic that we're discussing today, and that is safety for your loved one when they can no longer live at home. What are your options? What questions do you need to ask? How do you make the right decision for your loved one and yourself for peace of mind? So again, I'm here with Esther Woghiren. Yes. I'm sorry, Esther. And Esther owns 6, I'm also here with her husband, David, but he doesn't want to talk today. They own 6 personal care homes in the Marietta, Georgia area, but no matter what market you're listening to us from, it's information that's good for anywhere, any market. So we talked briefly about personal care homes and the care that's given and the ratios of care. And I'm just going to kind of recap quickly. Regulations state that you only need one caregiver during the day per every 15 patients.
Yes.
And at night, 1 per 25.
25.
But this might be a benefit for you if you want your loved one to get a little bit more extra one-on-one time.
That's right.
In a personal care home, in Esther's beds, what is the typical bed count? Is it 10 or less, or is it 6 or less?
6 or less.
Okay, in a personal care home, there's 6 or less beds. So you still have a caregiver in there, but
That's
it's
right.
now 1 to 6.
That's right.
Even though regulations state 15
1 to
or
15.
25.
That's right.
And in Esther's homes, she has a caregiver living on site.
That's
so
right.
there's always 1 to 6 at the very worst. And oftentimes it's 2 to 6.
2 to 6.
Okay, I got that right?
That's right. That's right.
Okay. Now, just to extrapolate on that a little bit more, let's dive into the whole regulation situation here in Georgia. Because with assisted living facilities now being more, it's more difficult for their residents to stay. How does that affect a decision regarding whether to put a loved one in an assisted living facility and a personal care home? And let's know that my audiences right now don't know what I'm talking about, or might not know what I'm talking about. So
Yes.
Can you keep it simple for me like you did for your lady in the last segment?
That's right. Well, like I said, most of the residents come from the big assisted living because they can only keep them to a certain time. So instead of going to nursing home, which some families don't even know about, you can come to personal care homes because we can do the one-on-one care. You know, the big assisted living are able to do so much because of the staff to resident ratio. But in the personal care home, because of the ratio, we are able to keep your loved one there. They don't necessarily need to move to a nursing home for them to get the care. With the regulation, we are actually, for the big ones, it's being regulated a lot because, you know, if you have like 10 wheelchairs there, the state won't let them keep it. But for our homes, it's only 6. You can actually have up to 3 wheelchairs, so you can keep that.
So in essence, in Georgia, and stay with me if you're listening from another community other than Georgia, because there's still more important information that it pertains to all of you. But in Georgia, with the regulations right now, what they're in essence doing for these assisted living facilities is they're making them more a high-functioning social environment versus
right.
folks that really need
the care.
good care.
That's right.
And then if they have too many people that need more care, they will tell you that some of them need to go.
They need to go to nursing home. I get that all the time.
To go to a nursing home.
Nursing home, yes. But they can come to personal care homes. So that's why I'm here, to make sure families have alternative. Because we actually like to say we're alternative to a nursing home. They don't have to go to a nursing home. They can still come to personal care home and receive good quality care and still have the same benefit they were having in the assisted living anyway.
Because you have that lower ratio. And
that's
you can
right.
help keep them safe easier. Okay, so in addition to, are you faced with placing a loved one because they're independent on their own and they can no longer live independently, if you find yourself in a situation where your loved one's in an assisted living facility, especially here in Georgia because of our regulations. And they're being told they have to leave because their care is getting too heavy, you do not necessarily have to put them in a nursing home.
Yes.
Please know your rights and interview and get to know personal care homes too before you make your decision as to which nursing home or which personal care home is going to be best for your loved one.
That's right.
Does not necessarily mean they have to go to a nursing home.
No.
And the personal care home is a very home-like setting. It looks like a house.
Yeah, they're all residential building. It's just like home.
Can you describe what your homes look like?
Okay, my homes, this is very important. They're all ranches. One level homes, because it's very important that you keep them on one level because of falls.
Right.
So they are all one level homes, and each person have their own room, or if they're sharing room, they'll have a shared room with someone else. But we have common dining area, common TV area, and they share bathrooms. It's 1 person to 3 person to 1 bathroom in most cases. But some cases you can also have your own private bathrooms.
Okay. And it truly looks like a home.
It is
versus
home.
an institution.
Yes, it is
so
home.
if your loved one is no longer able to stay in an assisted living facility and you want an option facility versus a home-like setting, please, please, please think about a personal care home. And if you're in Georgia, call Esther and she can connect you to one in your area, a good one. Okay, so we talked about some questions that were very important for folks to ask during the first segment.
Right.
I just want to reiterate that you want to talk about what is the caregiver ratio. How many caregivers are going to be here at night with my loved one? How about this one? Does a doctor come around?
Yes.
And do you have a doctor that comes around to your personal care home?
Yes, I have a doctor that come around. Like I said, I work with the medical community a lot. I have podiatrists that come in there. I have a dentist that come in there. I have hospice companies. I have home health companies, and I have a doctor that make a visit once every month.
Very good.
Yes.
Okay. So they come to the loved one in the building. You don't have to be taking them all over the place, which can increase the risk for falling.
Exactly. And also inconveniencing the children. You're trying to come in and take mom to doctor's appointment. We just try and make everything very simple so that they can receive all the care within the home.
If they choose.
If they choose to.
Yes.
Actually, they still have the option if they want to go to the outside doctor to go.
And that's another point. Let's talk about how active someone can be in the life of their loved one who's living in a personal care home. It doesn't mean that you just put somebody there and that's where they are. So talk about, you can come and check them out and go to the beach and go wherever you want.
That's right.
How does that all work? Do you have any parameters on that?
Okay. Visiting hours, once we open in the morning at 9 a.m. to 8 p.m., once you put your parents in my home, you don't have to call me and tell me, oh, I'm coming at 3 o'clock or 4 o'clock. And that's another mistake family member make. You don't do that. Come in, show up anytime. That's going to show you who is taking care of your mom.
I love that.
Yes.
Let's reiterate that. Do not announce your appearance.
Yes.
If you really want to know how your loved one is being taken care of, just show up.
Just show up. Just show up.
Because the norm is the norm is the norm.
That's right.
So what you see when you get there is probably the norm.
That's right.
Very good, Esther.
Yeah.
Okay. And they can take their family member out.
They can take them out for the weekend. I have people come and go to dinner with their loved ones for lunch anytime they want to. They're not restricted.
Or if they were going on a week's vacation.
Yes, we're going on a vacation. You can come and take your loved one and you go with them.
So there's very few
It's just like their home. I always explain it like this. If you put in your parent in our personal care home, it's like her own apartment, her own home. So if you're doing anything with her, all you have to do is just call and say, we're going to be going on vacation. You still keep that dignity and respect for this resident.
Dignity, yes, so important. Let's talk a little bit more about regulations. We touched a little bit on it. But let's talk about how sometimes, as good as an assisted living facility is, their hands get tied.
That's right.
About being able to keep a resident there, which makes me so sad. I really get frustrated, and it's nobody's fault. It's our state. It's our laws.
That's right.
But if I've already made the decision to move my mother from her home and place her somewhere, and she gets to know folks there, my heart breaks to hear that now she has to come away from her new home that we just got her acclimated to and she's comfortable in to go somewhere else. So can we tell folks why that's happening here?
Okay, there's a regulation on that with the state. They feel like if the person is no longer able to propel a wheelchair by themselves, they shouldn't be there. They claim it's a safety issue. So the assisted living is not able to keep somebody like that. Well, recently they did pass a law in July that surpassed that now. If you have an assisted living that's licensed for 25 or more, you can. But also there's alternative, like in a personal care home, I'm sorry, we have to apply for a waiver to keep the residents, because I fight for that a lot. Because if somebody's already living somewhere, that becomes their home. I don't think anybody have a right to move them against their will. They can age in place, without being forced to go to a nursing home just because They can't do propel their wheelchair. That doesn't make any sense.
And I truly don't know the answer to this. So if you are advocating to get waivers for your folks because you believe aging in place and not having to move them again is the right thing, are you more likely to get those waivers approved than a larger assisted living facility? And is that why they don't like to ask for too many waivers?
Yes.
That's true?
That's true, because we're smaller. I've done these waivers several times. Family members love to come with me, and I love that. We can talk to them about the needs of this resident and the wishes of the resident. And they don't need to be moved again, you know.
So you could have 3 people on hospice out of 6.
That's right.
Or 4.
That's right.
Okay, because you're going to fight for them and go down there with the family member.
That's right. To make
Okay,
sure.
there's another question for you all to ask. And I know no one ever wants to think about the decline of a loved one. But, you know, they say there's 2 things certain in this world, death and taxes. And so there's some things we just can't avoid. And the best thing to do is to prepare for them so that we can live the best lives till we have no more breath left. And that is hospice.
That's right.
And so if you are doing your due diligence and trying to figure out where is the best place to place mom or dad or your loved one, one other question you want to ask is, what is your philosophy on aging in place and applying for waivers so that my loved one can stay here? Because this is a difficult enough decision, and I don't want them to move, if that's your choice. And very, very important, because I can tell you, not everybody's like Esther who's going to bring the family member down to fight for it. No. And so if that is something that's important to you, please ask that question and make sure you make the right choice for where that loved one is going to go, or you'll end up having to move them.
Yes.
Do you find that most personal care homes now are fighting for those waivers, or are people not? It's all across the board.
Well, I'll just say it depends, because for me, I know of my homes. I know of my personal care homes. I know a few personal care homes that do the same thing. They call me for advice sometimes, and I tell them what they can do. If you feel like you want to keep a patient, you have to fight for it. You have to apply for a waiver, you know, and talk to the state about keeping this patient. Like you mentioned something good about hospice. It's very, very important, because at that point that the resident is needing more care, we can consult hospice. That's additional service for the family, actually, and the residents. They can age in place with hospice care, and we providing the care. Together, we'll give the residents a better care.
And you know, still folks don't really know, but hospice is not a place. Hospice is a type of care.
That's right.
And so if you have a loved one in an assisted living or in a personal care home and they're declining and they meet criteria for hospice, hospice can then come in addition to all the other care that you're getting from the personal care home.
That's correct.
And now Esther has the help of another nurse, another aide, and a social worker to help with financial paperwork and making decisions, and a chaplain, and another doctor, because now that doctor is going to come out and do face-to-face visits on those residents as well. So, you know, not to sidebar here, but I get passionate about this too, because
That's right.
people are so fearful of making tough decisions. And as hard as it is to make a decision to place a loved one in a facility, when safety's safety's at stake, and you can't really deny it much longer. With hospice, you can deny it till it's too late to make the choice.
That's right.
And so I just want to implore people as well, on a sidebar note, if your personal care home caregiver is telling you, we think maybe it's time for home health or hospice or additional services, they're with your loved one.
Yes.
And don't fear the additional resources just because of the word hospice.
Yeah.
Because if people get the additional help, a lot of times we can keep those folks out of the hospital, free from infection. We can keep the body as strong as possible, because we know what happens when we're chaotically put in an ambulance and sent to an ER and sent to the hospital. We come back a lot weaker.
Yes.
And so we can, in fact, with hospice coming to you, maybe keep your body stronger and help you live longer.
That's right.
And a better quality of life. So I love that Esther also brings in community resources to help her in the care of her residents when they need it, because the more the better. And she understands that. So if you have folks advocating for those additional resources, Don't be mad. Don't be sad. Don't be scared. It's additional resources for the benefit of your loved one that they paid for in their paycheck their whole life.
That's right.
Into the Medicare program. So they deserve it. Okay. I'm going to get off my soapbox now. Let's talk about financial situation. We talked a little bit about the cost of personal care homes. Can you reiterate what that cost is for a personal care home?
For personal care home, the average private rooms are $2,500, and the semi-private runs from $18 to $22.50, like I said earlier on.
And is that typical of all personal care homes, or is there a gamut between different personal care homes as well?
It's not typical. Like I'm speaking for my home right now.
Right.
I can tell you about another personal care home, but it actually ranges from what I just gave you. Is actually, in the range of personal care homes.
But it could go up to $3,500 or something.
Yes,
okay.
Yeah.
So also, when you're making a choice, interview a few to help you make
That's
that
right.
choice.
That's
Always
right.
best to get as informed as possible. But also, we want to make sure that folks that are just tuning in, the difference in price between the personal care home and in the assisted living facility, typically the assisted living facility is far more expensive.
Far more expensive.
By like a couple thousand.
Yeah.
Is that right? Yeah.
A couple thousand, yes, that's right.
Okay.
And let me also stress that in our homes, we don't have additional fee. We actually give you fixed price. When you move into the home, we give you a fixed price. We don't charge extra for medication, extra for incontinence care, extra for food or laundry services. No, we work everything into that one fixed price. That's all the check you're going to be writing every month. Because I've heard the stories of them
That's
having
true.
Additional fees.
There is typically a stepladder
Yes.
approach. Oh, I don't know if it's typical, so I shouldn't
Yeah.
say that. But I have heard of stepladder approaches where you come in healthier, and then as you need more and more and more care,
care, it
you go to
increases.
different levels
That's
of care,
right.
and those different levels are different higher costs.
That's right.
Which can make sense in my brain as well,
right.
but you have to ask the questions.
Ask the questions. Yeah.
Is this a stepladder approach where it's going to increase monetarily as I need more, or is this a fixed price, as in Esther's case, where no matter where we go from here, I don't have to adjust financially because I'm budgeting already?
Yes.
Okay. How important is it? Do you find a lot of folks come to you and they just haven't had any communication at all about financial situation their loved
Yes.
ones in?
A lot. I've been looking for this opportunity to tell folks out there, you need to speak to your parents. You need to ask what their wishes are, where the money is, what kind of insurance they have, if they have long-term insurance, or like I mentioned, VA, if anybody in the family was in the service. So you need to find out all that information before you start looking for a personal care home. Because sometimes people come and look for, and you tell them the price. They say, oh, I don't know how much my mom makes. I mean, those are the homework you have to do before you actually figure out what's the option here for my parents.
And there's a wonderful book out there, and I like it because I'm not a lawyer and I'm not a doctor, and it's very simple terminology and easy to understand. But it forces you to have conversations that can be difficult. So
Yes.
people will not typically use it. But it's called the 5 Wishes booklet. And in that booklet, it helps you have conversations about, hey, you know what? We're all getting older. I'm going to fill this out for myself. Mom, dad, loved one, I need you to fill this out with me too, because should anything, God forbid, happen to you, I need to know what you want me to do.
That's right.
And included in that book is information about finances. Because if you're faced with a sudden crisis, mom or dad has a stroke or has dementia and isn't able to talk to you and can't remember, if you could just rewind the clock and have that conversation, but it's too late.
That's
so
right.
push through the difficult conversations and get your paperwork in order, because you're going
right.
to be helping your loved one, because you're going to be able to give them their wishes.
Yes.
More importantly, you're going to be able to help yourself. Because, and I often talk about this, when your loved one is no longer here, you have a whole life to live.
That's right.
We don't want you carrying regret and guilt around. If you know what your loved one's wishes are and you push through that difficult conversation, you're able to make better decisions and live the rest of your life at peace
That's
over
right.
what you did and those decisions that you made. You've seen that over and over, haven't you, Esther?
Yes, I see it every day. Every day.
So I talked about the 5 Wishes booklet. Do you know of any other resources that are great for someone to use to have those conversations with their loved one?
I can't think of any on top of my head right now, but I put some on my website, additional resources on my website, where they can go and find some information. And you can go to the www.thebritneyhouse.com website and find out some resources for your loved one or yourself.
Is that thebritneyhouse.com?
Yes.
Okay.
The Brittany House.
Okay. Great. And why don't you give us your phone number again and
Okay. The
full name so people can contact you?
Sure. It's the Brittany House Assisted Living. My name is Esther Woghiren, and the phone number to reach us is 678-313-4673.
Okay, we only have a few minutes left, Esther. It always goes by so fast.
I know.
As you're in the hot seat, you're saying, I hope this is hurrying up. No, I'm only kidding. So what top 3 things do you want to leave folks with that are in this situation right now?
Okay, I want to leave them with hope. There's hope for you. There are resources out there. You just have to look for them. And also you have to, like I said, talk to your parents early, make arrangement, make preparation for this because it's coming so fast. Okay? So, and don't be afraid to ask questions. Anywhere you go, any personal care home or assisted living, ask questions. That's how you're going to get the best.
And know that as our parents age, there is going to be some financial sacrifices that we have to make for our parents.
Mm-hmm.
I mean, I'm in that sandwich generation, taking care of kids and looking at my mom, who's getting older, and everything's hunky-dory right now. But I know down the road, I'm going to have to be shifting some finances to help keep her as independent as possible and living as well as she possibly can. So, you know, when I got married, my father said, Jeannie, a car payment's a fact of life.
Mm-hmm.
You got to have a good car so you can get to work and make some money.
Yes.
And aging is a fact of life.
Yes.
You got to have good conversations so that you can prepare. And you don't have to live in a hotel in your last days, but you do have to make some adjustments and think about the future of your parents as well as yourselves.
That's right.
And so it sounds simple for me to say, but preparation is so important.
Very important.
If you're putting a little bit away every month for 5 years and your loved one needs to go somewhere, you have something there to get them through.
That's right.
It's not in crisis.
That's right.
All right, Esther. Well, thank you so much for joining us.
Thank you for having me.
It was a wonderful show with very good information. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead. And listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.